Good day everyone. We are the Group 5 and today we're going to present a case presentation about the isolated bilateral macrodontia of mandibular second premolars. This case showcases collaboration between multiple disciplines such as oral surgery and orthodontics. So first, we need to identify what macrodontia is. Macrodontia is also known as megadontia, megalodontia, or macrodontism. It is a type of shape anomaly that is rare and used to describe dental gigantism. For this case, we have the isolated macrodontia. This type of macrodontia is more frequently found in incisors and canines and has been rarely reported to involve premolars and molars. In particular, macrodontia of premolars is extremely rare and may be confused with fusion or gemination of adjacent teeth to form a single tooth. Now, we have here the patient's record. She is a healthy 12-year-old girl and was referred to the Department of Pediatric Dentistry for consultation concerning local crowding associated with macrodontia. She has no remarkable medical history with no family history of any genetic or dental anomalies. We also have the initial examination findings of the child. She has no trauma related to the jaws. She is in late mixed dentition stage with angle class 3 molar relationship, and her mandibular or maxillary primary second molars are exfoliated. Now we have here two figures. Figure 1 shows the view of the premolar regions from both sides. It can be seen that a large mandibular left second premolar was attempting to erupt between the normal size first premolar and first molar teeth. Figure 2a shows the panoramic radiograph showing the macrodont mandibular second premolars, while B and C are the periapical radiographs of the right and left premolars respectively. Radiographic examination of the jaws revealed the presence of mandibular second premolars of abnormal size and morphology. The right premolar was distally impacted, and its large size multitubular crown was in contact with the mesial root of the first molar. The conical root was in close proximity to the inferior alveolar canal and had a large single root canal space. Meanwhile, the left premolar was partially impacted and showed similar crown and root canal morphology.
Let's now proceed to treatment planning. It is where structured outline of the procedures and strategies are designed, and this is where the coordinated approach developed by a team of dental professionals assess the patient's dental need. For this case, 3 dental professionals are needed in order to facilitate this rare premolar macrodontia. First, we have pediatric dentistry. Since the patient is 12 years old and still on its late dentition, she is still under the care of pediatric dentist. Under this care, clinical examination and radiographs are done to see the situation of the tooth and its surrounding. Preventive care is also done by maintaining good oral hygiene to avoid infection. Second, we have oromaxillofacial surgeon. Since the microdontia teeth of the patient could lead to crowding, surgical extraction of these teeth with the help of oral surgeon is crucial to prevent any further complications in the future. Additionally, oromaxillofacial surgeon could interpret CBCT result of the patient and could give any recommendations since this case is rare and requires a collaborative approach. Lastly, orthodontics. Since not all teeth are fully erupted yet, installing of fixed appliances that correct spacing issues and alignment of teeth are done by orthodontists. They are responsible for the evaluation of the impact of macrodontia in occlusion and alignment of the teeth. Collaborations. These are the roles of each specialist. First, pediatric dentist. Pediatric dentists are first to identify dental issues that may require orthodontic or surgical intervention. They evaluate the child's oral health, development, and alignment of the teeth. They determine if a referral to an orthodontist or oral surgeon is needed. Second, orthodontist. Orthodontists evaluate the alignment of the teeth and jaws, assessing how these issues might interact with or be impacted by potential surgical interventions. They provide detailed diagnostic information that informs treatment planning. Third, the oromaxillofacial surgeon. They evaluate and diagnose conditions that require surgical intervention, such as impacted teeth, jaw disorders, and facial injuries. They can interpret well radiographs such as CVCT to assess the case of the patient.
For this dental case, I'm going to explain to you what are the procedure and technique that we use. First step is the pediatric dentistry. The pediatric dentistry manage the patient overall dental health, eruption, guidance, initial treatments, conduct a true clinical examination, including the assessing occlusion, true eruption, status, and crowding. The second is the dental or oral surgeon. If the size and abnormal morphology of the tooth pose a risk to adjacent structure, extraction may be preferred approach. Focusing for the distally impacted mandibular right, second premolar, and for the partially impacted mandibular left, second premolar. And the last one is we need an orthodontist. After the surgical intervention or extraction, begin orthodontic treatment to correct the angle class 3 molar relationship and manage the residual space from extractions. Monitoring and adjustment are required periodically and to ensure the proper alignment and the occlusal outcomes. And for the result and outcomes for this technique and procedure is the expected result of the proposed treatment for macrodontia, crowding, and malocclusion in this patient are favorable, involving the successful eruption and alignment of teeth, correction of occlusion, prevention of complication, and overall improvement is aesthetic function and oral health. With the appropriate interdisciplinary coordination and patient compliance, the treatment outcomes should provide a long-term stability and satisfaction.
Isolated bilateral macrodontia of mandibular second premolars of a 12-year-old girl is an extremely rare dental anomaly. This case report is presented through a clinical examination and radiographic findings. The young girl presents with posterior crowding of mandibular teeth associated with macrodontia. Patient is in her mixed dentition stage and also had an angle class 3 molar relationship still associated with this dental anomaly. To supplement this rare and complicated case, radiographic examinations will be great for accurate and thorough assessment for further examine the condition. Panoramic radiograph shows the most accurate picture of the total anatomy of the region. In some circumstances, a well-positioned periapical radiograph is okay as long as the parts of the impacted tooth are visible with important adjacent anatomy. A cone beam computed tomography or the CBCT scan may be useful to show relationship of the roots to the inferior alveolar canal. Radiographic shows abnormal morphologies of two mandibular bicuspids. The right mandibular premolar shows distoangular impaction with a multitubercular crown and with its mesial root in close proximity to the adjacent tooth and with its distal root near the inferior alveolar nerve. The left premolar was partially impacted, showing the same morphology and size presented with the right premolar. Treatment for this would involve an interdisciplinary collaborative approach to the following individual specialization in the dental field. First would be your orthodontic specialist. It is for your orthodontic manipulation, for it would be a great deal to correct tooth crowding and misaligned teeth, as well as jaw expansion. Braces, retainers, and expanders would be great treatment for its class 3 molar relationship. Second would be the oral and maxillofacial surgeon for surgical extraction. Early extraction of impacted teeth is recommended since mandibular bone of younger patient is less tense, pliable, more flexible during tooth removal, has optimal bone healing phase and faster regeneration of the PDL. Young patients have better response to the healing phase of surgical removal of impacted teeth. Lastly would be the patient's attending pediatric dentist. For most pedo patients, they are not easily handled and managed. It takes special skills to control how they react and behave to the procedure and treatment presented. Pedodontist has the magic sprinkled of managing these young pedia patients to cooperate and have a positive response to the procedure without traumatizing them.
In conclusion, isolated bilateral macrodontia of the mandibular second premolars is an extremely rare dental anomaly. Hence, it particularly requires an interdisciplinary collaboration approach along with advanced radiographic assessment. However, the interdisciplinary collaboration approach depends on the size and morphology, since macrodontia can create a variety of functional and aesthetic problems that may require more multiple collaboration specialties such as endodontic, prosthetic, surgical, and/or orthodontic treatment. Along with the features and treatment of this rare anomaly, this case also reports and illustrates the benefits in terms of treatment planning and surgical technique. So with interdisciplinary collaborations, it can establish and potentially result in better patient care, reduced cost, expedited delivery of patient information, and an increase in perceived patient quality of care. Furthermore, it affects patient care by allowing for a more comprehensive understanding of a patient's needs and challenges.